Have you ever wondered what exactly it is that your doctor is listening for when he or she uses a stethoscope to check your heartbeat? He or she is listening for an unusual sound, like a swishing or whooshing that may be a heart murmur. Today, I'll inform you about the different types and categories of heart murmurs. Within the past few months, I myself was diagnosed with a slight heart murmur. Mine, like many, is not threatening or detrimental to my health. Here's an example of a normal heartbeat. And here is an example of a heartbeat with a heart murmur. There are two main types of heart murmurs, innocent and abnormal. Innocent heart murmurs are fairly common, especially in young children. Abnormal heart murmurs are signs of a heart problem. In children, abnormal murmurs are usually caused by problems that the child is born with. However, in adults, these abnormal murmurs are commonly caused by damaged heart valves. Some heart murmurs are also caused by a heart that is thicker than normal. Innocent heart murmurs are actually common in healthy kids and are not threatening. No precautions are required in dealing with these murmurs. An influx of blood through the heart is another potential cause of innocent murmurs. Those who have abnormal heart murmurs may have signs of heart problems. In children, most abnormal murmurs are caused by heart defects or a structural problem within the child's heart. In adults, abnormal murmurs are caused by conditions such as infection, advanced high blood pressure, heart attack, heart failure, and simply aging. There are also three different categories of heart murmurs: systolic, diastolic, and continuous. Systolic murmurs, according to doctors at Lucile Packard Children's Hospital, occur during a heart muscle contraction. According to Clinical Methods by Kenneth Walker, W. Dallas Hall, and J. Willis Hurst, a systolic murmur is a murmur that begins during or after the first heart sound and ends before or during the second heart sound. Diastolic murmurs occur during heart muscle relaxation in between beats, and the resulting noise is made while the heart is filling up with blood. Many diastolic murmurs involve a narrowing of the atrioventricular valves or regurgitation of the semilunar valves. Continuous heart murmurs are murmurs that occur throughout the cardiac cycle, but are relatively rare. According to the Journal of Medicine and Life, the continuous murmurs are often intense, rough, and accompanied by quivering. Many heart murmurs are found and diagnosed during regular doctor's visits. If a doctor hears a murmur, he or she can tell the severity of that murmur, and the doctor will look for other signs of a heart problem. If the doctor thinks the murmur is a sign of a more serious problem, the doctor will recommend further testing. These tests might include an echocardiogram, an electrocardiogram, an X-ray, or a cardiac catheterization. An echocardiogram is an ultrasound on the heart, and an electrocardiogram, or EKG, checks the electrical activity of the heart. An X-ray shows the size and shape of the heart and the arteries, and an cardiac catheterization is when a small tube is inserted into an artery and pushed to the heart. From there, a small amount of dye is injected, and the resulting pictures show how the dye moves throughout the heart. Most heart murmurs are normal. There is nothing to be done to prevent them. However, eating healthy and exercising regularly promotes a heart-healthy lifestyle. Thank you.